Hello again, everyone. This is Scott from Strive Labs, reaching out to wish you all a happy March 1st and also a happy Get PT First Day. Hopefully you all are getting behind this on Twitter and throughout your social networks. We're definitely getting behind it as well here. And I wanted to do a special Tuesday tip to sort of tie in a lot of the same concepts, right? What we're all spreading the word about today is the idea that PT is an awesome first choice modality for musculoskeletal disease, musculoskeletal injury. All right. And we've heard a lot of people talk about different ways we can get this word out. Well, one of the things I want to focus on today is the fact that even though some of your patients have been in to see you, they know that you do great things, they know that you're an awesome first choice provider for care, sometimes they forget that they can actually see you first, right? I think a lot of people get so caught up in the day-to-day grind that they forget about it, right? They forget about that fact and they think they might need to go see their doctor first, or they may just forget about you altogether. And we're going to make sure that that doesn't happen, all right? And so I want to show you how a lot of our customers are actually accomplishing this right now using StriveHub, but I want to also share how you can do a lot of these things on your own, even if you're not using a tool like StriveHub. So let me dive on in and show you. So we've shown you a few different times that you can think about announcements, right? Different types of email content that you can send out to your patients. Well, one common announcement that a lot of our customers use is a direct access reminder. So again, it's this idea that, hey, did you know that you could see your physical therapist directly? And what they'll do a lot of times is just provide some education back to that patient to let them know that, and a lot of, especially if your state is a full direct access state, that you can do that with no script required or no referral required. And what a lot of people do is they then tie that back to a landing page, right? And so landing pages are great. I think every clinic should be using them to some respect. And so not only can you use landing pages just for things like this, where you can get them to sort of sign back up if they might be having an issue, but what a lot of people also do is the idea of a free wellness screen. So again, we have a lot of customers right now who create a similar campaign where basically they'll send out some information about a wellness screen that they're doing just to try to re-engage with past patients. Now, we've been talking about patient retention a lot, right? We've been thinking about it within this context, right? But this is just really the first pass, meaning a patient comes in as a new referral and then they become a current patient and then they're retained in course of care, which is great. We've kept them from dropping out. But ideally, we can also think about retention not just within the course of care, but within the lifetime of that relationship with a patient. Now, again, the idea here is that they now know that you provide excellent value, but if they get injured again, and we know that these types of injuries, they happen on a very, very frequent basis, 1 in 2 adults are going to develop these conditions every year, we want to make sure that if they need help, they come back to see you. All right. So when we're thinking about retention, remember that we can think about not just course of care retention, but also lifetime or clinic retention. How do we really build that patient for life? So what a lot of clinics then do is they say, hey, let's reach out at a certain point past a discharge. Let's send out some of these campaigns, whether it is something like a wellness screen or just a reminder to let them know that they can see their therapist directly. And then they'll link it back. They'll link it back to some sort of landing page, which again, just the most important piece is that it has some type of capture form so that they can enter that information, and then provides them some context about the activity. We've seen a lot of success for customers who are using this method. It's a really effective way to stay in touch and just put yourself out there. So remember, even though a patient has come to see you before, always remember that they may forget the fact that PT is a first choice option. And now, what you can do is you can put systems in place to make sure they don't forget about that, make sure that you're reminding them, because it's important, not just to think about how we can educate the general population, but even how we can educate past patients on the idea of getting PT first. So as we always talk about, this is something StriveHub makes really easy to do, but there's no reason why you couldn't be doing similar things with other tools. Make sure you look at them, research them, make sure that they're HIPAA compliant, make sure that they are able to house that patient information safely. If you have any questions, feel free to reach out to us. You can hit us up on Twitter at strive_labs. You can reach out to us, hello@strivelabs.com, or you can reach me directly, scott@strivelabs.com. Guys, it's been great. Hopefully you're all spreading the word about getting PT first. If there's anything we can do to help you out, please let us know. Have a wonderful, wonderful March.